Hey, and welcome back to the channel. This is Mentally Speaking with Dr. JB, where I do mental health content and lectures. Right now, we're doing a series about the basics, not only the basics of mental health, of like what to look for when you need help, but how to get help and what help can look for. This is the second part of the series where we're talking about how to get help and what that help can look for, like types of therapy. Today we're going to talk about types of medication. But the first part of this series, which I strongly encourage you to watch, are kind of like those diagnostic things, what to look for. The purpose isn't for you to self-diagnose, but for you to have an idea of like, I might need to go get some help, or maybe I should encourage such and such to get some help. So look out for those lectures. I go through so many diagnoses, and today we are going to talk about the medication component, which is near and dear to my heart because I am a psychiatrist, and that is what I am trained to do as a medical doctor. All right, so let's get on with it. Okay, I'd like to try medications. So this is a discussion about starting medication management or starting medications. So first let's talk about when should you consider medications, because medications aren't necessarily the first line. A lot of times people will say try a therapist first or try other resources first. But let's think about, when do medications come in the picture? So first thing first, when I talked about where to get help, plate resources, I should have put it first, but I didn't. But it should be first that you should go see your primary care provider first. I want you to go see them first because they will rule out if your mental health condition is really a symptom of a general medical condition. So after that has been ruled out, either by labs or by physical exam, sometimes you're having these symptoms, they can't be better explained by anyone else. This is when to consider medications. Now, this doesn't say you have to do this before starting medications, but it's a good either first step or something to do early in treatment. So I highly recommend it. Then another time to consider medications is if you have a diagnosis that can be treated with medications, and medications are either first line or first line with therapy, or could make the treatment easier. So that's kind of obvious. And then the third part is to better participate in therapy. Sometimes you're in therapy, but sometimes you're doing so unwell that you need medications just to kind of level things out a little bit so that you can accept the therapy, either even be able to do the skills or even be able to process and accept what's said. So types of medication management providers. So in addition to a primary care provider referring you to a psychiatrist or a mental health practitioner, they can prescribe medications themselves. Also, mental health prescribers, we have psychiatrists, NPs, PAs. In some states, trained psychologists can prescribe medications. And then I'm saying medications, but there are also naturalists that will recommend nutritional supplements or what have you. And any of the other mental health prescribers, and I readily do this myself in my own practice, may recommend supplements or nutritional additives. Something else to add is that there are other providers other than primary care providers that might recommend psychiatric medications. OBGYNs or obstetrics and gynecology specialists, they can recommend mental health medications. Neurologists can recommend mental health medications. Any doctor can, but usually it's either a primary care provider, a psychiatrist, and maybe some of those also specialists that see people with mental health conditions more often. So you can see these providers just like therapy, in person, virtually, and some even by text, and what we call asynchronous care, where I guess I haven't really seen it in practice, but you can say what's going on. and they get back to you, and then somehow you get medications. It happens, it works somehow, somewhere, but it is a way. So, what happens during the first interaction? We talked about this when it comes to therapy, that you may experience all three, one, or a variation of these. However, um, no matter how they happen, it doesn't really dictate how the treatment is going to go. It's usually sometimes just a preference or style of the provider. The number one thing, just like in therapy, be honest from the beginning. You're not officially in treatment until you're prescribed a medication or until the initial evaluation is finished, but just still be honest. Like, being honest doesn't mean just telling everything necessarily, but it's telling what they need to know and just being honest about those things. Just always want to start off on a good foot, whether it's starting a therapy relationship or a medication management relationship, rapport, or how you engage or how well you get along with the provider just matters so much. So let's go through what all these things are. Questionnaire. So this may be a questionnaire, maybe a rating scale, maybe a few questions about your history, what have you. It can vary. Phone interview. Phone interviews are important. They're really important, and you may or may not get a phone interview. But if you see that a provider requires a phone interview before the initial interview, don't be like, "Oh, I don't want to go through this." It's not a waste of time, because it'll save you a lot of time and save them a lot of time from you all being a bad match. So do the phone interview and use it to your advantage. This is how. So you want to see if the advantage, if you want to see if the psychiatrist is a good fit for you. So what they should be asking, or what you can expect them to ask, is, what are you looking for? Any history of self-harm, any history of suicide, any substance abuse, any recent hospitalizations, anything I should know. But what you should be asking them, because this is about you and your treatment, is, what's your approach? Are you more into natural things? Are you into medications only? Do you believe that people should be on medications forever? Do you believe like we only do medications sometimes and only a little bit? How fast do you put people on medications? How long are the appointments? How long is the evaluations? Will you talk to my therapist? Do you do therapy? Can you help me find a therapist? And just in general, what are your thoughts about treatment? What are your philosophies? Like, when are you going to make a decision? What do you feel about diagnoses? Like, try to get a feel of what this provider is about, because that matters. And this treatment is about you. It's about you. It's not about this provider getting another patient. It's not about you feeling bad about wasting their time. It's about you getting better. So let's knock all that out. It's about you. So you want to make sure that you're finding the provider that's best for you. So then let's say we get past the phone interview and we do the initial evaluation, which can range in thoroughness, can range in length, can range in how many sessions. But overall, they're going to go through your diagnoses, they're going to go through your symptoms, they're going to go through past history, past medication history, past therapy history, family history, substance history, social history, what have you, past hospitalizations. They're going to go through a lot. So be patient with these providers for both therapy and when it comes to medications, because although it may feel like a lot, all of it is needed and all of it matters. So before starting any medication, you want to make sure that you have given informed consent. So let's say they don't do this. Let's say they're like, you want to start this? Don't say yes until you know what the medication is used for, like all the uses of the medication. What are the benefits of the medication? Like, what is it expected to do? What are the risks? Because there's risk to anything. There are risks to everything. So if they say there's no risk, that's not true. The best we could say, there's minimal risk. If they say there's no risk, say, okay, what are the risks, right? What are the risks? And what are alternatives? Let's say I don't like this. what's kind of next down the pipeline, or what is something else I could use other than this, and what are the differences between them? You need to have this information. It is important for you to make an informed decision on what you're going to be taking and what's going to be going into your body. So, how do you get this information? Now, first, ask your provider. If somehow they didn't mention it, get the answers. Yes, you ask them. Now, let's say snaps. I just picked up my Zoloft, or I picked up my Seroquel, and I didn't ask my provider. I don't even know. Ask the pharmacist. The pharmacist has an information sheet. Now, let's say you're even further in the process. Oh man, I didn't. You just seeing this, you're like, oh, I didn't know this was a thing. You can go on trusted websites to get patient information about any medication that you're taking. NIH, NAMI, very good. Very good websites to get patient information. Also, the APA, American Psychiatric Association, has a patients and families page where you can get information about diagnoses and medications. So there's no reason why, if you are able mentally to process these things, why you shouldn't know why you're taking it, what it's supposed to do, what could possibly happen, and what else could be helping, else could be used to help me. Noteworthy side effects. So I'm going to help you out. Remember we talked about the risk, and they would say no risk? That's not true. And it's not true, but I want to tell you about some side effects that if they don't bring up, you could say, what are your thoughts about this? So when it comes to antidepressants, because of the serotonin that's in that serotonin is a neurotransmitter. It's essentially what a lot of these medications are changing or increasing in your body. Because of that, there's associated side effects with it. So some people, and this is when I say side effects, please don't think that everyone gets these. Actually, most people don't get the side effects. And that's how a medication even gets put out, because it is believed it's going to help more than hurt. So even though a side effect is possible, that's not expected actually. Where it's expected to help, medications are expected to help without side effects. But these are some things to look out for, because we don't want you to be miserable. Because the solution could just be lowering the dosage or changing the medication. We can go back to the drawing board. There's nothing, you don't have to be stuck to anything. Always a give and take with your provider. So antidepressants can cause what we call GI symptoms or stomach issues. This can range from nausea, vomiting, diarrhea, constipation. A lot of these symptoms, if you have any of those, they do go away with time with antidepressants. That's one of the symptoms that's usually not expected to stay. Some antidepressants make you really activated, like you have tons of energy. Some make you feel like you want to go to sleep and you can't get through the day. Tell your provider, they might switch when to take it. That's another thing. A lot of these side effects may have easy solutions that don't mean stopping a medication. And I'm going to say this right now before I even go through the rest of the side effects profile, because we got a few here. Don't ever abruptly stop a medication. Please. On behalf of your medication provider, don't do it. Don't abruptly stop a medication. If you feel like a medication isn't for you or isn't working, can you please just let them know before you do that? Because you never want to stop these abruptly, because stopping these medications abruptly can cause a whole list of other symptoms that, trust me, you don't want. So always let us know. And then with antidepressants, unfortunately, there could be sexual side effects. And this is from even wanting to have sex. This is like during sex, there can be issues, including dryness or or decreased pleasure. And then so anywhere in the sexual spectrum, it can possibly hurt things. There's also weight gain that could happen with antidepressants. I just want to let you know that whatever these side effects are, A, that doesn't mean you have to stop the medication. Let your provider know so that they could make changes. And B, it's not guaranteed that any of this is going to happen. We hope, and usually these side effects don't happen. That's why the medication is out in the first place. Mood stabilizers. So these are things like, and then before, antidepressants are things like Zoloft, Paxil, Prozac, Lexapro, Celexa. Wellbutrin, dot, dot, dot. Those are kind of the antidepressants. Mood stabilizers, these are more like Lamictal, Depakote, lithium, what have you. Main side effects of these could be fatigue, but also a lot of these might require labs to check on the kidney, to check on the liver. And then if you're taking Lamictal, they'll talk to you about this. But if you have any rash, if they haven't told you, I'm telling you now. If you're on Lamictal and you have a rash, let them know immediately. Immediately. Let somebody know if you have a rash on Lamictal. Antipsychotics. So these are things like Seroquel, Zyprexa, Abilify, Latuda, Caplyta. There's so many. Vraylar. These medications can cause sedation. They can also cause movement issues. So I mean, it won't look as fluid like that, but sometimes like jerky or like even like dancing like movements, mouth movements, little twitches, those things can happen. And so that doesn't mean immediately stop the medication. In fact, when you do immediately stop the medication, it makes the things worse. So if you notice more twitching when you start a medication or more movements or things that just aren't quite your normal, let your provider know. They'll make changes. And it's not to say if one medication in a class causes those things that another one will. And this goes with all the side effects. And then with antipsychotics, we want to think about something called metabolic syndrome, which includes high blood pressure, elevated sugars, elevated lipid levels, and increased weight. And to be honest with you, it is independent of just only a calorie deficit or things like that. However, that doesn't mean that it can't be helped. It's just that when you're on an antipsychotic, you have to just be more mindful of what you eat, how much you eat, nutrition in general, exercise, mindfulness, stress reduction to combat that metabolic syndrome that may occur with antipsychotics. And I say may because this doesn't happen with everyone and with every medication. So if you notice, oh snaps, I'm gaining weight. Oh, my pressure's a little higher. Talk to your provider and they could hook you up with a nutritionist, or they themselves can help you with diet and exercise or whatever resources you need to kind of combat these side effects. And a lot of times, even for the other side effects, we have other medications or other strategies, things you can do to help yourself or to be helped. And then sleep aids. Sleep aids, obviously, this is like not Abilify, Ambien, Lunesta, hydroxyzine. This can cause sedation, dizziness, and also for some of them, people have what we call parasomnias or do things in their sleep. So sleep talk, sleep eat, sleep activities. So just something to think about if you're taking any sleep aid. Talk to your provider like, okay, does this medication do that? And with any medication, do not stop it abruptly. Don't. If you get anything from this lecture, don't stop any medication abruptly. It can cause headaches, fogginess, irritability, worsening symptoms. It's just not good. It's not fair on your body. It's not fair to you. Just let somebody know and they can let you know, hey, just do this or that. All right. We're in agreement. Now, while in treatment, please don't forget, you're not stuck. Ask us about the provider and both access for both the provider and the medication. Is this still a good fit? Do I trust this psychiatrist? Do I trust this medication provider? Is this a good fit? Is this medication doing more good than harm? Do I feel heard? Are we just changing things without you even knowing what my symptoms are? Do you agree with how the person prescribes? Do you agree with the diagnosis? You are not stuck. Have that conversation. But whatever you do not stop the medications on your own. Don't do it. Please don't do it. Okay? Do the medications work? Am I having side effects? And discuss when and if you can stop. There are guidelines about when and if you should stop medications. Um, just have a talk, an open talk with your provider about what the options are. And if you feel like they aren't working for you, you are not stuck with that provider. You're not stuck with that provider. And let's say you are stuck with them because access to care, I can't act as if it's not an issue. If you are stuck with that provider, tell them, listen, you're not hearing me. You're not listening to me. I need you to listen to me. I need us to work together because I want to be well and I don't feel well. Let's meet at a common ground. Let's have some compromise. So just know you're not stuck. Don't feel stuck. And especially if there are options, explore other options. Discuss medications with your provider. Some people may get annoyed, but when my patients bring up, "Oh, I saw such and such on TV," bring up such and such on TV to your provider. Say, "Hey, I saw on TV that this new medication, is that true? Have you ever tried that on a patient? Do you think it will help?" Have an open discussion. So I want you all to always feel empowered with therapy, empowered with medication management. As much as we're your providers, we have more expertise, and we've been doing the training. You know your body, you know yourself, you know what you're gonna do, you know what you're not gonna do. We got to work together for this to work. So we could do this, but you gotta be real with yourself. If it ain't working, it ain't working, and we got to get back to the drawing board. Okay, all right. All right, I'm back. So thank you for joining me for yet another riveting discussion about treatment. Take home message all the way. Don't stop anything. Don't stop a medication on your own. Don't do it. Please don't do it. But at least message your provider. Something. Just don't do it and just a month later we're like, "Oh, I stopped that." And we're like, "Oh, I thought you were still taking it. And I raised the dosage. Who knew?" Don't do that. Please don't do that. Please help on behalf of the whole community. Just don't stop it abruptly. Talk to somebody, aka talk to your provider and make the adjustments. All right, so thank you for supporting me. Don't forget, like, subscribe, notifications when the live comes. This will be pre-recorded. Therefore, I will be in the chat when the premiere for this happens. And don't forget the Patreon, which is going to have all that brand spanking new content. Also, it will have a bracket of like founders, which are like, the price is going to go up, guys. It's going to go up. But founders, you get locked in at a low price with quite a bit of content still, things for you to watch. And then there's also a supporting bracket for those of you like, keep doing this. We're so proud of you. And we want to fund it. There's that bracket too, and I thank you so much. And then there's the Udemy courses. At some point, all of these lectures will be edited and added to my Udemy page. Since this is a previous lecture series, it's going to get added as an update to that lecture series, but future lecture series will be be organized for themselves. So if you want all the fluff out, if you want all the technical difficulties out, if you want all the, I'll be back real quick out, and you just want the content, the Udemy and the Patreon will be perfect for you. All right. Y'all have a marvelous day. I hope y'all are having a fantastic day, and I will see you guys later.